So, I mean, obviously, the two phase 3 trials that have been announced are nivolumab ipilimumab with the checkmate 214 and atezolizumab bevacizumab with Immotion 151. I think what's most appealing about the 214 data was the impressive CR rates, specifically at that PD-L1 positive subgroup. It was 16% in the study. But even the PD-L1 negative was like 7%, which is comparable to what we gave for IL-2, which we still think about giving. So, I mean, those are impressive. I think when you look at Immotion 151, they also had an impressive CR rate, I think around 9% overall in history. What's really, I think, the most appealing thing about that combination is its toxicity profile. It's a very well-tolerated regimen, as opposed to the checkmate 214, where it seems to be, the data suggests right now, at least, that it's only for intermediate poor risk by IMDC, and then maybe the good risk don't get the same benefit. When you look at the subset analysis of Immotion 151 with atezo-bev, you seem to have a benefit across subgroups independent of risk status. So obviously we'll see what happens as those move forward in the future. And then obviously we have multiple ongoing phase 3 trials which are inspired by phase 1 data. And all of those, to varying degrees, have very impressive response rates, upwards of 70 to 80%. Now that's taken with a grain of salt, and these are phase 1 trials. They tend to be very favorable intermediate risk patients, less poor risk patients. But hope that those response rates translate into the phase 3 data and hopefully improved disease control and CR rates.